And it seems like we're live. Hi, everyone. So, as usual, we're going to wait for 15 people before we officially begin talking live with Mei Sze. It's a Sunday at 3:30 p.m. I know many of you are probably out and about, but now it's CMCO here in Malaysia. For those of you who are watching from Singapore, I hope that you guys are tuning in and also staying safe at home. During this time, I would like to ask you to please share today's live stream with your friends, your family, because we have a special guest today who is a specialist for you to ask questions. I think many of us want to know, we need more information. This is the best time to join the stream, ask questions because we have a professional on the stream. So we're going to wait for 15 people. It looks like the meter jump. We have 17 already. So I am going to begin. Once again, please share this with your friends, your family, so they can tune in right now and ask the questions that they need to ask. All right. So good afternoon. Welcome to Talking Live with Mei Sze. Today is the finale of a three-part lung cancer series, which I've been doing in the month of November. This is the third and final one. This is in collaboration with the hashtag Knowing Lung Cancer campaign embarked on by three societies, which is the Malaysian Oncological Society, Lung Cancer Network Malaysia, and the National Cancer Society of Malaysia. It's hashtag Knowing Lung Cancer. And this is also in conjunction with Lung Cancer Awareness Month. So last week, we talked about immunotherapy, and the week before, lung health and lung cancer. Today, we're going to focus on targeted therapy. So if you're a cancer patient, cancer survivor, or if you live with someone who has lung cancer or generally has cancer and would like to know more about targeted therapy, please ask them to join this session right now. And of course, I would like to encourage all of you to start putting in your questions because we don't want a backlog of questions at the end of the session. So I'm going to dive into what targeted therapy is from my understanding. It is a type of cancer treatment that target patients that targets proteins that control how cancer cells grow, divide, and spread. They're either small molecule drugs, which are small enough to enter cells easily, so they're used for targets that are within the cell, or monoclonal antibodies, which are proteins designed to attach to specific targets found on cancer cells. So that's my basic understanding. But of course, we have the specialist here. He's probably judging what I'm saying right now. I use this thing called Dr. Google. And also going to different conferences, I also learned a bit about targeted therapy, immunotherapy, and the various forms of cancer treatment. Targeted therapy is also one of the more advanced forms of cancer treatment. So let me introduce our guest for today. He is a representative from the Malaysian Oncological Society. We have Dr. Tan, who is an oncologist and he treats most solid tumors, is actively involved in clinical research, as well as having special interest in breast, hepatobiliary, and lung cancer. So today, our topic is on targeted therapy and the importance of lung cancer screening. So guys, remember, put in your questions now. We want to hear from you. We want you to engage with us because we have a specialist here today to help answer your questions or your queries. All right. So hi, Dr. Tan.
Hi, Mei Sze. Thanks for having me in your show.
Thank you. Thank you so much for joining us. So, Dr. Tan, thank you once again for joining today's stream, Talking Live with Mei Sze. I'm going to jump straight into the questions. Good afternoon to all of you saying hi. Hi.
Hi,
Remember, please
everyone.
share this right now because we have Dr. Tan on board live for you to ask questions. So, my first question is, could you give us a refresher of the Knowing Lung Cancer campaign?
Okay, so I think being a representative from the Malaysian Oncological Society, the MOS in short, so we have been always in the forefront for all cancer related activities, being it whether it's related to healthcare providers, cancer patients, the survivors, or their caretakers as well. So I think this year, in collaboration with the Lung Cancer Network Malaysia, National Cancer Society Malaysia, and CSM, so we have we are actually trying to create this awareness and trying to address all the other aspects of lung cancer during this Knowing Lung Cancer campaign, which is actually started since 1st of August, mainly on the social media front. So I think as you mentioned before, so this is actually the finale of the three parts that you actually did. So started off with the first one from Dr. Azrif, which is the president of Malaysian Oncological Society, and then followed by Dr. Tolaiman, which is the co-founder of the Lung Cancer Network Malaysia, and currently myself. So we will be trying to address the importance of awareness and lung cancer screening, as well as all the other aspects, including the treatments options currently available for lung cancer patients in Malaysia. Yeah.
Thank you, Dr. Tan, for sharing more about the campaign. So I see many of you just joined in. Hello. And Sunny said that at last managed to get through. I'm glad you managed to get through. I'm not sure whether the connection today is bad, but I do hope you guys are still trying to get through because this is a live stream. If you ask your questions, I see many people asking questions after the live stream, but we cannot answer them because we are not going live. So you have to join us now. All right. So the second question is last week's session was on immunotherapy for everyone watching. But what is targeted therapy? All of us would like to know.
Actually, I think just now you already did a very good explanation on what is actually targeted therapy, but probably I put it a bit more so that layman's terms, so that easier for people to understand is that I think in some cancer cells, especially lung cancer, they actually have this abnormality that we can actually try to detect, and then when you detected all these abnormalities, what happened is that I think the researchers or the scientists, they actually have developed these drugs which can specifically target these abnormalities. So hence the name called targeted therapies. So what you need to do is that you actually need to do further tests on the cancer cells. And if you found this abnormality, which is currently you actually have a drug that can target it, then you actually can use those drugs to treat those patients with this abnormality. So generally that's what by targeted therapy means, which means that you generally have to have a target before you actually this drug can work on that particular target. So not necessarily everyone also can use this targeted therapy. It's only those with this so-called identified abnormalities in the cancer cells. Yeah.
So, by the way, I know a lot of people on targeted therapy because immunotherapy is the most advanced in terms of technology, but targeted therapy is more suited for quite a lot of different types of cancer, from my understanding.
Yep.
So, the next question, I think many people would like to know, can anyone go for targeted therapy?
Actually, like I mentioned earlier, no. The answer is because you need to have the targets for the drugs to act on. So generally, the respective of the types of cancer that you have, of course, bearing certain type. So you can actually need to do the test to identify all these abnormalities first before you can actually use the drugs. Of course, there are certain tumors, like say kidney cancers. Okay, some of the subtype, which is what we call the clear cell variant, which is the commonest. So without doing further testing, you can actually use the targeted therapy on this clear cell renal cancer or kidney cancers. But in other tumors like lung per se, which is our main topic today, so you actually need to do the test to detect these abnormalities, whether it's actually present or not in the cancer cells, before you can actually use this targeted therapy.
I see. So you would say that not everyone can go for targeted therapy, but targeted
Yes.
therapy is more available for various types of
Yes, not
cancers,
just for
right?
lung cancer, not just for lung cancers, yes.
Okay.
Mhm.
So, based on your experience, do many people who come in with cancer, in the case of lung cancer, for example, know about these various treatment options? Do they know
Mm,
about it? Because
um,
everyone keeps thinking there's only chemotherapy and radiotherapy. And I know some of you think that chemotherapy will kill you, but that's not true.
Okay, so yeah, I think like you mentioned, it's very true. Unfortunately, I think in our country, Malaysia itself, compared to our Western counterparts, where the majority of the patients, when they come in, they do have very limited knowledge on the lung cancer as well as on the options of treatments available to treat their conditions. Generally, they still have this perception that lung cancer is just a one disease, and the only available treatment is either radiotherapy, surgery, or chemotherapy, without knowing about all these options of immunotherapy or targeted therapy. Sometimes I do wonder, like, when some patients actually come in, they actually know more about alternative medicines, like, Sabah Segras or vitamin C or that kind of thing, more than the actual treatments options available for their own conditions. Yeah. So this is actually a sad thing.
It's very true, Dr. Tan. I think a lot of people come in thinking that okay, if the doctor tells me I have to go remove this, like for
Mhm.
women maybe, if I have to remove
Yeah,
my breast, I rather go for the alternative medicine,
yeah,
or if I have to remove, or if I have to go for chemotherapy, I'll immediately go for alternative medicine. But
mhm.
I think the more important part is that people should know that that is not just one of the options. There are many options out there, which we are talking about today, and one of them is targeted therapy. Which would you say that this also preserves the quality of life for patients?
Definitely, because I think let's talk about just targeted therapy on lung cancer itself. So I think there's definitely enough studies or enough evidence uh, being to shown that this targeted therapy for those patients who are suitable with lung cancers, they actually can control the disease better, prolong their life, and then the disease actually also responded. That means that actually they shrink and become smaller compared to chemotherapy, as well as it's actually more convenience, as well as it's actually less side effect as well compared to conventional chemotherapy. Because most of the targeted therapies for lung cancers are actually in oral forms. So patients just need to come in once a month, to
I
check their
see.
bloods, and then they just go in with the oral medication and just pop the tablets or the pills, as compared to conventional chemotherapy where they actually have to come in, spend hours in the daycare to have this infusional chemotherapy, which sometimes can do cause a bit more side effect compared to this targeted therapy. But of course, even with the chemotherapy nowadays, I think with the pre-medications and post-medication that we actually prescribe, and we try to adjust the dose according to the patient's body weight and things like that, majority of the patients are actually able to get through even chemotherapy without much of a problem. So, like you mentioned earlier, sometimes they mention that chemotherapy kills, especially I heard from who and who, after just one dose of chemo and that person passed on or passed away because of the chemotherapy. But in actual fact, I think sometimes you do not know the real story behind it. That maybe the patient themselves already in stage 4, very ill condition. They might or might not pass on soon, but just because after discussing with the doctors, they actually wanted to try and see whether the chemotherapy able to help to prolong the disease by a bit longer and kind of thing. But unfortunately, the chemo might not work and the patient still pass on. So that is probably made more to because of the condition of the patient and the disease rather than because of the chemotherapy. Yeah.
So, to be honest, it's amazing how for targeted therapy, you can just take a pill once a month and that is the
It's once a
treatment.
day. It's once a day.
Oh, once a day, but that's
Once a
still a
day.
pill. It's just like taking a supplement.
Yeah, yeah. So generally, sometimes it's one tablet, sometimes it's like more than one. So it depends on the type of targeted therapy that we are talking about, and as well as the dosing that we are giving.
I see.
Mhm.
So, what is molecular testing and why is it important?
Okay, so I think this molecular testing is a more nicer name that I mentioned earlier, that you actually need to do this test to look for these abnormalities. So, so generally, say someone being diagnosed with lung cancers, so there are actually different subtypes, and among certain subtypes, you actually can do this molecular testing, or what I call you try to look for these abnormalities in the cancer cells to see whether you can use certain specific drugs or targeted therapy to treat these abnormalities or not. So of course, the nicer name is molecular testing. So the results from the molecular testing will be able to tell you whether, number one, whether how likely are you going to be responding to the targeted therapy that we're going to prescribe. So if, for instance, someone actually doesn't have these abnormalities and you were to take that drug, then chances are most likely it's not going to work, even though it might be an expensive treatment or new treatment kind of thing. So in a way, this molecular testing will be able to help you to predict. We call it the predictive markers, to see whether how likely are you going to responding to a certain treatment. But of course, this molecular testing sometimes also they will be able to tell you the prognosis or how well the patient is going to do generally, because certain markers is actually associated with a poorer prognosis for certain patients as well.
See. So,
Mhm.
molecular testing uh, is very important to determine
Yes,
whether you can go for targeted therapy or not.
yes,
Correct?
correct. So
Okay.
these are generally true, especially in advanced stage of the lung cancer. Mhm.
Okay. So, is targeted therapy only applicable for certain types of cancer? If yes, what types of cancer are those?
So I think, like I mentioned, there are actually many tumor types which is you can use targeted therapy. So of course, lung cancer being one of them, kidney cancers, and then after that, even colon cancers, you actually do have the targeted therapy, but they might not come in a form of oral therapy. They are still injectable, which is the monoclonal antibodies, like you mentioned earlier. and other type like even breast cancers, some targeted therapy can be used together with the hormonal therapy to treat some of the breast cancer patients, and etc. etc. So actually, in fact, nowadays targeted therapy is actually available to treat a lot of solid tumors. Mhm.
I see. So, for those of you, I have a few more questions actually, two more left. Please bring in your questions now. We don't want a backlog at the end. I see some of you putting in your questions already. So, please start putting in your questions now so Dr. Tan can answer them. So, the next question I had is targeted therapy available in all hospitals?
Okay, so I think generally I will divide it into public hospital as well as private hospital. So for private hospitals with oncologists or oncological centers, generally all these targeted therapies are available to them. And for regard to public hospitals, again, it's only those public hospital with oncology center, which is actually there's actually six in the Ministry of Health hospitals. So actually targeted therapy is actually available, but it's not, you might not have the full range of all the targeted therapy, but they do have targeted therapy to treat certain cancers, and it's actually available in the public hospitals. So like for lung cancer per se, they actually do have targeted therapy available, but it's mainly on one of the subtypes and not covering every single subtypes as well.
So, you said six public hospitals in Malaysia, right?
Yep.
Okay.
So yeah,
Uh,
so yeah,
they
sorry.
are.
Okay. So they are HKL, and then IKN, which is the National Cancer Institute, and then Penang Hospital, Johor, Sabah, and Sarawak. So they actually have these six Ministry of Health hospital, which has these oncology or cancer centers where these treatments is actually available.
I see. Okay, that's very good information. I hope all of you took that down. Last but not least, from me, what are the benefits of targeted therapy?
So, like I mentioned, of course, in terms of the convenience, because it's most in lung cancer is mostly available in oral form. So you just need to pop the tablets at home once a month. I mean, every day, not once a month, every day. And then after that, you just need to come in every month for follow up to check up, to see whether is there any side effect and how well are you tolerating the treatment, and whether the treatment is actually beneficial or not. And then, of course, I think from all these numerous studies and evidence have shown that this targeted therapy are actually more tolerable in the sense that they actually has much less side effect. Therefore, patients are able to maintain their quality of life. And then they are also more effective in the sense that they're actually able to give you a better response rate, as well as controlling the disease for a longer duration, and as well as prolonging life for some of this treatment as well. Yeah. So, but generally, targeted therapy in lung cancers are mostly used in the stage 4. Of course, there are some evidence to show that they might be useful in the earlier stage. But again, having said that, even though with all this immunotherapy or targeted therapy, but nothing beats someone being able to present themselves and being diagnosed at earlier stage of the lung cancer, because those are curative treatments and patient potentially can do better compared to all these treatments that we mentioned, targeted or immunotherapy, which is generally used for patient with stage 4 disease, even though they are able to give you a quite good quality of life and control disease for a longer duration, but these are all non-curable treatment. So again, I would like to stress the importance of diagnosing the cancer earlier by doing the lung cancer screening.
So, guys, remember early detection is very, very important. I myself cannot stress that. Without early detection, I would probably be wearing a colostomy bag for the rest of my life. Honestly, I'm going to be very frank with you. Early detection for any cancers is important. And for lung cancer, we know that there is lung cancer screening for you to actually detect it earlier on. So now we're going to take questions from all of you. Please put in your questions now. Dr. Tan, I'm going to
Yes.
take the first question, who is from, this question is from Teo Chong. Can you please share the list of government hospitals in Klang Valley that can treat or provide oral treatment for stage 4 lung cancer for patient age 70 plus?
Okay.
Wow. That
So I think besides the Ministry of Health hospital, the six Ministry of Health hospital that I mentioned earlier. So let me just remind you again, for Klang Valley itself, there's actually GHKL as well as the IKN, or the National Cancer Institute in Putrajaya. And then on top of that, there are actually also public hospital under the Ministry of Education, which is the University Malaya Medical Center, as well as the HUKM, which is the National University Medical Center as well. So these two hospitals, actually medical centers, also has the oncology center or cancer centers where these treatments are actually also available.
Okay, I hope that answered your question, Teo Chong. Now, Faith Lam, she says, "Good day to you. She has stage 4 adenocarcinoma metastasis to spinal bone. She tested EGFR, ALK, ROS1, all negative, PDL1 less than 1%, chemotherapy, Permatrix, and carboplatin done 4 times. She's now
Mhm.
undergoing Permatrix and MVASI as maintenance treatment. MVASI? I don't know.
MVASI,
Yeah,
MVASI.
yeah.
I
So
think
please share. She says, please share what is maintenance chemotherapy and how long will it benefit? How long do I need this type of treatment? What is MVASI? Is it a targeted medicine? Please recommend should there be any organization offering clinical trials that is suitable for her type of cancer?
Okay, I think for MVASI, if I'm not wrong, it's actually a name. I mean, we call it the trade name of a drugs, which is actually a monoclonal antibody. In a way, it is actually considered one of the targeted therapy for lung cancers. But generally, so it's actually given together with the chemotherapy. Like in her case, it's actually carboplatin and pemetrexed. So in terms of how long she needs to be on this treatment, is that normally they'll be continue for the treatment for 4 to 6 cycle, and then of course in between they will assess her to see the response, whether these actually drugs are helping her or not. And then after 4 to 6 cycle, what the doctors normally do is that we actually might consider to stop the carboplatin and then put her to continue as a maintenance on this so-called MVASI as well as the pemetrexed. But of course, it's also very much depending on the toxicity, whether she actually has any side effect or not. So sometimes the doctors might choose to just continue with MVASI, or they can choose to continue with just pemetrexed, or actually both, because these drugs are also quite costly as well, you see.
I
And then with
see.
regards to the clinical trials, I think since she already started the first line treatment on the advanced lung cancer, so you actually need to look for whether is there any trial which is actually offering second line, meaning that those patients who actually did not respond to the first line treatment and then go for second line. But as far as I know, in my centers, like in ICANN, so we actually at this moment we don't have a second line trial for lung cancers. But actually, I think you can try to find out more from the Malaysian Oncological Society. We actually do have a tab on resources for patients to find out more, because we actually link up with the another organization that actually runs a lot of all these clinical trials. So you can find out more information from there. But as far as I know of for right now, for her for her case specifically, I don't think we have any specific trial which is suitable at this moment in time.
All right, thanks, Dr. Tan. I hope that answered your question, and I hope that you get better, Miss Faith Lam. So, Dr. Tan is involved in various clinical trials, as I mentioned earlier, specifically on hepatobiliary, lung cancer, and breast.
Yes.
So, if you have questions, you can direct them for those specificity as well. So, the next question is from Sunny Lim. What about cost? Is this offered to patients in government hospitals? So yes, I believe it is offered to patients in government hospitals. The
Mhm.
cost, I'll pass it on to you, Dr. Tan.
Okay, so I think because generally targeted therapy for lung cancers, they actually ranges from a few thousand ringgit a month to more than 10,000 ringgit a month. So it depends on which drug specifically we are talking about. So in the government hospitals, we do have the targeted therapy for lung cancers, but like I mentioned earlier, you don't have the full range and you don't have all the targeted therapies being made available to you. But if for those who is actually available in the government hospital, it's actually provided you at a very much subsidized rate. And especially if, let's say, you are a government servant, or let's say your parents or children is actually a government servant, you can actually get it for free. And then, but if let's say you are not, then you probably will only need to pay a very subsidized rate of just a few hundred ringgit a month to get that medication, which it might cost you a few thousand ringgit.
Yeah, I mean, from my understanding as well, the ones from a young cancer survivors group who they go to government hospitals, it's very, very subsidized in terms of costing. So
Mhm.
definitely, uh, I would recommend it if you do not have insurance, and or if your doctor is also in a government hospital. So the next question is from Marcus Leong. He asks, "What's the difference between targeted therapy and immunotherapy?"
I think if you were to follow our live chat with Mei Sze since last week, where Dr. To speaks on immunotherapy, is actually very much different. So generally, I think to begin with is that when someone is being diagnosed with lung cancer, so like I said, because there are actually multiple subtypes, so you need to know more on what are the subtype of lung cancers. And one of the things that we do are this molecular testing that I mentioned earlier to look for whether is there any abnormalities or not. So let's say there is actually an abnormality being detected, and there's actually a drug available. So you generally will be treated with this targeted therapy that can act or target on these abnormalities. But if let's say the lung cancers, after doing all these molecular tests and you do not detect any of these abnormalities, then what you can do is that you can actually go for immunotherapy or in combination with chemotherapy, depends on the PDL1 status. So generally, immunotherapy is very different from targeted. So targeted therapy is most of them is in oral form for lung cancers, and they have a specific target to act on. Whereas for immunotherapy, what they do is that they actually inject it into your body, so they enhance the body immune system so that you can actually recognize and detect the cancer cells, and the immune system will actually eliminate the cancer cells rather than actually the drug acts on it. But in targeted therapy, actually, is the drug itself who act on the abnormalities that works on the cancer cells. But immunotherapy is actually not the immunotherapy acting on it, but more of enhancing your body immune system so that you can actually recognize and detect the cancer cell and destroy it. Yeah. So I hope I answered your questions.
Yeah, that's a really good summary, Dr.
Mm-hmm.
Tan. Uh, so the next question is from Sunny again. Will targeted therapy replace surgery? Ooh.
No, I think this is actually quite a general question. So maybe I should explain to you is that if let's say someone is being diagnosed with early stage cancer and there's actually surgery is still an available options. So generally we will recommend to the patient to go for that because that is actually a curative intent kind of treatment. Whether the patient actually required any treatment, additional treatment after the surgery, that will be very much depending on the stage and the HPE reports after the surgery. Targeted therapy will never substitute a surgery because targeted therapy is actually for not curative majority at this moment in time. It's actually just to control the disease to prolong the survival, so that the disease doesn't spread and worsen as fast as it should. So actually, it's not a substitute unless you are talking about in certain cases nowadays. There are new evidence to suggest that after surgery, in certain subtype certain subtype of lung cancer, patient actually can be put on targeted therapy, which have shown that they might actually help to delay or reduce the risk of the cancer coming back. But generally, majority of the usage for targeted therapy is still in advanced stage at this moment in time. So I think to simplify is that I think no, it's not a substitute for surgery because one is actually a curative intent treatment, another one is mainly for control. So it's actually a huge difference. Of course,
Okay.
in certain cases, uh, where patient might have a small tumor, but because of other factors like age, or maybe underlying medical problem, patient might not be suitable for the surgery, even though it's an early stage, then yes, you might put a patient on the target therapy to control the disease for a longer duration. Yeah, but those are isolated cases.
Thanks a lot, Dr. Tan, for being so thorough in your reply. So, Yogimi asks, so targeted therapy is not a cure, but to prolong life. That's one
Yes.
question. And once one is on targeted therapy, would one have to take it for the rest of their lives? That's a
Okay,
good question.
so I think I briefly mentioned about that earlier. Is that majority of the targeted therapy in lung cancer right now is used in advanced stage. That means it's actually just to help to prolong life. That's why it's to control the disease for a longer duration to give a patient a better quality of life. But there are some evidence or new development coming up to show that this targeted therapy might be used for even those patients with earlier stage, where after they had the surgery, then they actually can be put on this to help to might reduce the risk of the disease to come back. Whether in terms of the duration, generally you need to take this targeted therapy in those patients with advanced stage, as long as the medication is actually helping to control the disease. So it can be potentially 1 year, 2 years, or 3 years. Of course, intermittently, your doctors will actually do assessment for you, either in the form of from the blood test or from the form of imaging like an X-ray or CT scan to see whether these drugs are actually still helping or not. You see, rather than you continue popping the medication for a year, without knowing whether this is actually helping or not. So intermittently, your doctors will actually do assessment for you, whether clinically or from blood or from imaging, to see whether this one is still helping out. And if let's say it do, then you should continue it until actually the medication doesn't work.
I see. Wow. Okay. It's quite expensive. Uh,
Yeah.
Yeah. So the next question is from Wong Po Kwan. Is Tagrizo available in government hospitals? Is it subsidized as well?
Okay, Tagrisso is actually not available in the government hospital, but it's available in the private hospitals.
So okay, so the second question is moot. Uh, and Faith Lam had the follow-up question. Her PDL1 is less than 1%. Is immunotherapy suitable for her?
Okay, so actually, for those patients with PDL1 less than 1% as well, there's actually evidence to suggest that you give the immunotherapy together with the chemotherapy is actually also do better compared to just chemotherapy alone. But of course, in if your PDL1 is less than 1%, generally, definitely just using immunotherapy alone is not an option because they tends to doesn't work so well in those patients with no PD-L1 expression. But there are some evidence to show that if you use it together with chemotherapy, they might still be better than just chemotherapy alone.
Okay. So this next question, I don't know, you can answer it however best
Okay.
based on your understanding.
Yeah.
Nikki J asks, is there any other herbal treatment for lung cancer?
Herbal treatment. Okay. So I think I do not know the herbal treatment what it means by here, but being oncologist practice in Malaysia for so many years, we have seen and of course we know or heard about a lot of alternative treatment options from patients. Like I said, from sabasne grass, from the apricot seed, vitamin C's, and even like some people even say that for the durian belanda or the soursop leaf, you boil with water, etc., etc. So we have seen it all, and I think at this moment in time, in fact there's actually not much of evidence to show that all this actually works. In fact, I actually had recently had a meeting with one of these Chinese medicine physician uh, to discuss about the treatment for cancer. So he himself, being a professor, with a renowned experience of more than 30 years, he also claimed that in terms of traditional Chinese medicine, the role in treating cancers is actually very, very limited. He will say that maybe probably the role might be more of like after patient completed the treatment, and then it's more of like to generate the well-being, the nutritional aspect bit on that. Or in certain cases, like acupuncture actually helps to reduce a bit of those side effects after the chemo, for instance, but not so much on the treatment of the cancer itself per se. And definitely, it's not a substitute for the Western medicine. Yeah.
So I agree with Dr. Tan. I believe that alternative treatment is a supplement to your existing Western treatment. So the
But
first line of treatment is always the Western treatment.
yeah, but we
You
have to
know,
be very careful on what are the supplements that you are taking in because
that's
sometimes
true.
this product being available, if you say that, oh, doctors, I look at the label at the back and it's all natural ingredients, so it should be safe. Just bear in mind that not all natural ingredients are actually safe, and sometimes they actually do not list out all the ingredients which is actually in the supplements or in the products. And in fact, some of the chemotherapy that we are using in our hospitals are actually derived from plants extract as well. So in the sense that you know that actually uh, plants are actually not natural. Sometimes it can be also, and potentially they also can cause some side effect and problem as well.
That's very interesting to know. Okay, some
Mhm.
of the chemotherapy is made out of
Yeah,
plants.
yeah. In fact, one of the
Okay,
chemotherapy that we tends to use a lot in like breast cancer or lung cancer even is actually derived from plants.
wow. Okay,
Yeah.
very interesting. So Anderson Ma asks, will in the future will more targeted therapy be available in government clinics, and how could government do more to bring more targeted therapy to the public?
I think this for this question is very difficult for me to answer because I think it's probably best leave it to the relevant stakeholders to answer the questions. Of course, I think with the advancement in the science and technology, with more targeted therapy being available as an option in the market, so generally because of competition, the price will definitely come down in the future. And because of the lower prices, then government probably might be able to make more of this option available in the government hospital. But I think to answer when and how and etc., I think that one probably might leave it to the relevant stakeholders to answer you, and I'm not in a
I
position to answer
agree.
that. Yeah.
So the next question is from Sylvia. What are your thoughts about Avastin, and how does it help together with Tagrizo? Are there any side effects to take note of for stage 4 lung cancer patients? That's three questions. So what
Okay.
are your thoughts about Avastin? How does it help with Tagrizo? And what are the side effects to take note of for stage 4 lung cancer patients?
Okay, so I think generally both are considered targeted therapy. Tagrisso being a tyrosine kinase inhibitors or EGFR inhibitors, we call it. So it can be used in both first line as well as second line advanced lung cancer. But of course, it's only if the patient have this presence of these abnormalities that I mentioned earlier. And in regard to Avastin, it's actually a monoclonal antibodies, but generally they are not being used in those patients with these so-called abnormalities that you can detect from your biomarker testing. So it's generally being used together with the chemotherapy, meaning that for those patients who actually do not have these abnormalities, where targeted therapy is actually available. Okay. So in terms of what's the next question again? Sorry.
Does it help together with Tagrisso?
I think the thing is, at this moment in time, there's actually no approved indication of the usage for Avastin together with the Tagrisso. Of course, I do know that there are some developments or some earlier research or trials being conducted on the potential combination of Avastin with some of this targeted therapy. But at this moment in time, there's actually nothing concrete being come out from this, and none of these combination has been approved to treat patient with advanced lung cancer.
And what are the side effects to take note of for stage 4 lung cancer
Okay.
patients?
So I think it's very much depending on the treatment that you're on. If let's say we talk about, say for instance, the two drugs that you mentioned earlier. So for Avastin, it's generally the side effect is more of like increase of high blood pressures, and then sometimes when they do the blood test or urine test, they notice that there's actually some proteins present in the urine, and then of course with Avastin, there's also a slight increase of risk of getting bleeding because of the mechanism of that particular drugs. But generally, they are quite tolerable, especially if, let's say, we choose the right patient to start on that particular drug. As regard to Tagrisso, is actually one of the third generation EGFR inhibitors. So being a newer generations, uh, when they compare it with the first generation, even generally they actually has a very low, less side effect compared to the earlier generation, and therefore actually most of the time they're actually quite tolerable.
I see. Okay, so not many side effects that to take note of then.
Yeah, but of course, if let's say you're talking about other treatments like chemo or immunotherapy, then it is also very important for you to actually discuss with doctors to identify what are the potential side effects and how they might present themselves, so that you can identify those signs and symptoms earlier, and then you can go back to your doctor so that it can be promptly treated, to prevent the side effect from getting worse before you actually seek treatment.
Okay, that's a good thing to note. So, thank you all for your questions. Thank you, Dr. Tan, for answering all of them very meticulously. I think everyone is very appreciative of you being on Talking Live with Mei Sze today. Thank you so much for joining us.
Thank you for having me.
So, in conjunction with the hashtag Knowing Lung Cancer campaign, remember to take advantage of the free low dose CT scan available in 8 participating hospitals. I will put the link up. All you need to do is show them the voucher, and you can get that free low dose CT scan in those 8 participating hospitals and a free consultation. In the meantime, please share this live with your friends, family, so they can learn from it and take note from it, not just for lung cancer, but for other types of cancer, and to understand more about targeted therapy. So thank you so much once again, Dr. Tan.
Thank you,
And thank you
Mazi.
all for staying tuned. I hope to see you guys next week. Next week, we'll do a session on diabetes. We're going to have Dr. Lee Ching Lee from IMU joining us, and we're going to talk extensively about diabetes and how diet plays a role in diabetes management. So I'll see you guys next week. And this marks the end of our 3 episode lung cancer series. Do understand more about your lungs and lung cancer, all right? And to those of you who ask questions, I hope you will get better, or the people around you will get better as well. Thank you so much. And thank you once again, Dr. Tan.
Thanks, Mazi. Bye.
Thank you. Bye.